On behalf of Boulder Community Health, it's my pleasure to introduce this evening's speaker, Robert Shapiro. Dr. Shapiro is board certified in interventional cardiology and cardiovascular disease. He received his medical degree from Medical University of South Carolina and then completed internal medicine residency at the University of Virginia and a fellowship in cardiovascular diseases at Washington University Barnes-Jewish Hospital. Prior to joining Boulder Heart, he was an interventional cardiologist at UC Health in Longmont and McFarland Clinic in Ames, Iowa. Dr. Shapiro sees patients at Boulder Heart, at Erie Medical Center in Erie, and in Longmont. Welcome, Dr. Shapiro.
All right, thank you for that kind introduction. And it's really an honor to be here today talking to you. Thanks for everyone who has tuned in for this talk. I think it'll be very interesting. And we've been through this, so I think, okay. So I want to go over my agenda for the evening so you kind of have an idea of what to expect. So to start with, I wanted to highlight some of the common consumer wearable devices. And looking at those devices, I wanted to explain how some of the health data that we frequently look at is acquired. And then I wanted to kind of dive into some of the scientific studies that support wearable devices in cardiovascular health. And then finally, I wanted to consider some of the ways in which to incorporate these types of consumer wearable devices into each person's health journey. So we'll dive right in. So just generally speaking, what are wearables? So these are consumer devices, that are meant to give health data. So we've seen really an explosion in these types of devices, and there's just been a multitude of companies who have focused on bringing some type of health data to people who are interested in buying their devices or wearing their devices. And the difference between these and what we consider a medical device is that there's very rigorous approval processes that have to be done through the Food and Drug Administration to be considered a Class 1 medical device. So generally speaking, these types of devices that I'll be talking about today do not undergo that full rigorous testing such that they could be considered a medical device, and we'll talk a little bit about why that might be important later. And then, but some of these have done scientific studies to prove certain benefits, and so as such, they have submitted data to get to support certain health claims. And we'll talk a little bit about that as well. So just some common examples, which probably most people are well aware of. Things like the smart watches, so the Apple Watch, the Fitbit, the Samsung Watch, the Polar Watch, the ones that are attached to other devices like computers or bike computers, like the Garmin watches, heart rate straps that people use for bicycles or attached to their smartwatches. Things like the Oura Ring or the wristbands like the Whoop Band. Some devices that are not really worn so much as carried around and then can be used at a moment's notice connected to a smartphone such as the Cardio Mobile. And then there are certain smartphone apps that also can track health data as well. And just looking at the wide range of things that are possible and where people have used such sensors, it does kind of have a full gamut of clothing or devices throughout the body. So kind of starting from the top to the bottom, things like smart eyeglasses or hats, earrings, headbands, shirts, bras, armbands, chest straps, bracelets, watches, wristbands, rings and socks. So it's kind of one of those things that if you can think it, they probably can put a sensor in it, and you could get data from it. The challenge is kind of finding which companies want to spend money to develop which products and which ones they think people will be likely to use and be likely to pay for, such that they can sell these products. And then the clinically useful metrics that are frequently monitored, and we'll go into more detail during the talk, things like heart rate monitoring, looking for arrhythmias, measuring your oxygen saturation, checking things like respiratory rate and blood pressure, assessing sleep or sleep disorders, looking for the maximal oxygen consumption so that people can track training trends, and then also looking at things like arterial stiffness and other issues with peripheral arterial disease. So I want to kind of focus briefly on how some of these wearables work and what types of things they look at to derive this data. So at a basic level, and really starting, if you think of early wearable devices, pedometers were kind of an early wearable device, and an accelerometer, which measures the acceleration of limbs or the body itself, can be an important tool in measuring motion and for things like step count or for fall detection. So that's an important one that's been around for a long time. Photoplasmography is actually using light to look at the changes in blood volume in the microvascular circulation, and so it creates these types of waveforms that look like the arterial waveforms, and so that is a frequently used sensor in wearable devices. To look at lots of different things, and we'll go over those in just a minute. Obviously, the electrocardiogram, which is what we frequently measure at the cardiology office to look at the heart rhythm and look for changes in the electrical wiring system of the heart, can also be derived from many of these devices. And then a seismocardiogram or a phonocardiogram actually measures the mechanical activity of things like heart valve opening, so we can get significant data about how people's heart valves open through some of these types of devices. And then a ballisticardiogram, which measures the recoil force in response to the ejection of blood from the heart. And so when we kind of look at what types of things the applications that we see and what types of devices can do this. So we see for like accelerometers that classification of movement, step counting, physical activity, and also fall detection. Obviously, like if you were to fall and you wanted your phone or your device to notify a family member, that would generally be the accelerometer that would be helping out with that. And that could be in the smartphone, wristwatches, wristbands, belts. For a ballisticardiogram, we can see cardiac energetics and blood pressure measurement using cuffless blood pressure technologies, which I think maybe some of the future with kind of non-invasive blood pressure or wearable blood pressure management on a more on a more routine basis in the outpatient setting. The ECGs help with heart rate as well as heart rhythm analysis, and that can be a small device that's attached to a smartphone or also a wristwatch. And then the phonocardiogram can help with giving data about the actual opening of the heart valves. And then photoplasmography, which I think is one of the most important, and we will continue. We'll talk more in depth about, but gives us a lot of different data, health data, including heart rate, heart rhythm, blood oxygen saturation, the maximal oxygen consumption, and also cuffless blood pressure measurements. So, I think that there are lots of different sensor technologies, and sometimes multiple sensors get incorporated into a single device. And so, the companies that have created these devices are trying to find things that work within, the amount of money that they're able to spend, such that they can create a device that's affordable for consumers, but also give great data in different ways. And so, focusing on some key aspects of this, I think that, the ideas that we really look at for physiologic measures that help us with regards to cardiovascular disease are things like physical activity, in trying to either prevent cardiac events, or from a primary perspective, such that before someone's ever had a cardiac event, or from a secondary perspective for those who actually have had a cardiac event in the past. Looking at ways to help with cardiac rehab from a home setting using the physical activity data. Tailoring exercise programs for things like cardiac disease or peripheral arterial disease, as we see both in the cardiology, in the the heart attack space, and also in patients who have claudication, or if they have pain in their legs from peripheral arterial disease. Both of those sets of patients derive significant benefit from exercise programs, and so trying to find cost-effective ways to get that done at home. And then also, potentially remote heart failure management, such that we help keep our heart failure patients healthy and out of the hospital. Clearly, as an internal medicine physician and also as a cardiologist, keeping people's blood pressure under control is an important way to help prevent cardiovascular diseases, renal diseases, strokes. And so, finding ways that patients can easily measure their blood pressure with wearable devices, I think is an important, future tool that may, again, help us adjust therapy, keep an eye out for developing high blood pressure in patients who maybe don't have that as a diagnosis already, and also to help, again, take care of our heart failure patients, and also patients who have known cardiovascular disease, such that we can, again, hopefully keep people healthy, keep them out of the hospital, and then improve their blood pressure control over the long term. Sleep is obviously an important part of cardiovascular health, and the challenge with sleep is that sometimes some people clearly know they don't sleep well, and some people don't realize they don't sleep well, and so having data with regards to that can be very important. And so some of these sensors can try to detect things like sleep apnea, which can be a strong risk factor for developing cardiovascular disease, stroke, high blood pressure, and also just generally speaking, the idea that getting an adequate amount of sleep helps with people's cardiovascular disease and helps prevent future cardiovascular disease is an important part of the equation. And then finally, kind of focusing on the heart rate and the heart rhythm. Again, heart rate can be very helpful with guiding exercise regimens, but also can be helpful with looking at, what should post-heart attack patients be doing, or what should patients with heart rhythm issues, should we be changing medications, or should we be making adjustments to their therapy? And so I think that that type of data can be very helpful for patients and their physicians. And then finally, with regards to the heart rhythm, that could be important in trying to identify new heart rhythm problems which aren't known, but also looking for whether people are having recurrence of a known abnormal heart rhythm, and also to help with changing medications, either medications that are trying to keep people in a normal rhythm, or medications that are trying to keep the heart rate controlled when people are in an abnormal heart rhythm. So kind of, again, following along these lines, obviously we talked, about heart rate and heart rhythm. Some of the key metrics that also some of these devices allow patients and clinicians to look at would be the heart rate variability, and that's kind of the pulse-to-pulse change. These are kind of millisecond changes in the heart rate that wouldn't be like necessarily noticeable to a person, feeling their pulse or listening to their heart rhythm, but can be a sign of either significant health or significant disease. And also the idea of heart rate recovery, the idea that how quickly someone's heart rate rebounds back to normal after exertion. And then, some other metrics, again, that can be helpful in understanding whether people are doing well or whether they're doing less well. So things like, watching oxygen levels, and if those are declining over time, there may be, that may be a sign that something has changed and that someone's doing worse. Monitoring the peaked oxygen consumption or VO2 max over time, and seeing if someone's training, whether their training is improving that type of metric, or whether if someone has a disease like heart failure, whether this is declining over time, and that's suggestive that they need to get back in to see their heart failure provider to see if something has changed such that they would benefit from changes to medications or other therapies. And so I think really, the clinical applications of these types of wearable devices include the idea of diagnosis of new problems, monitoring of known cardiovascular disease over time, helping with prescriptions for exercise that are tailored to a specific person, promoting just general physical activity, and then also looking again at performance and improvement for athletes. And obviously we see a lot of people in the Boulder community that are looking to try to do that. Some of the future directions, kind of expanding these to a diverse population, making certain that there's security of the data, looking for ways to integrate the data electronically and automatically with health records, integrating with artificial intelligence systems to glean important insights about how people are doing, and then making certain that things like medical legal liability and equitable access to diverse populations are available as well. And so just to, because plus mammography, PPG, is kind of one of the mainstay sensors that we talk about in these types of devices. I want to go through that just briefly. And so what you see here is that there's a light source, and there's two different ways. Either the light source and the detector are on opposite sides. So like a finger, if you think of like an Oura ring, the light penetrates through and gives a waveform similar to an arterial waveform, or if you think about a watch device, the light source and then the detector on the same side, and so it's measuring a reflection. And so what we do with that data, we can drive multiple different things. So obviously this is giving us a heart rate between these two peaks, or between the peaks or troughs here. The other thing that we can see if we integrate with the electrocardiogram and then the PPG waveform, this PAT time can be used to estimate arterial stiffness and also blood pressure. So that's one of the ways in which some of the devices may estimate blood pressure without a cuff. Similarly, if you have two PPG sensors in different locations, you can also measure the time between those. And again, they can estimate non-invasive blood pressure, cuffless blood pressure from that type of data. So again, lots of ways to look at this specific data, and then get actionable information for a given patient, and they can share that with their providers or use it for their own utility. And so, just integrating some of that data. So what you see, if you have a wearable watch, again, the light it emits goes down into the dermis, which is where these microvascular blood vessels are, in which they're reflecting off. And then what we see, for instance, integrating exercise, we see that the heart rate goes up with exercise, and we see that sustained elevated heart rate over time as someone is exercising, and then we see kind of heart rate recovery afterwards. And so that allows us to see, length of time for exercise, and also see, generally where the heart rate is during those activities. And again, we can use all that data to help drive prescriptions for what would be optimal. All right, so just in summary with regards to PPG, again, this is really one of the key sensors. I'm sure many of you have seen, you've noticed that like on someone's watch, you'll see some lights on the skin side of the watch at times, and that's really this type of sensor working. And I think the key point here is that you don't notice that all the time. So these types of sensors are not on 100% of the time because of battery life. And so the amount of data that is derived is somewhat limited by that. So that the proportion of time that it's on versus off does limit the data. But things like heart rate variability, rhythm, blood pressure, sleep. And so some of the devices have both an electrical heart sensor so that they can get an ECG, and also the optical heart sensor for PPG and also blood oxygen levels. To talk a little bit about heart rate variability, so again, this is the idea that there are millisecond variations in the beat to beat, the time between beats. And so this is like an exaggerated estimate of beat to beat variation. So this is helpful twofold. One is the idea that that these millisecond variations can be helpful to look at certain parameters that we'll talk about in a second. And also, if you start getting beyond that, then that gets into the level where we start looking at irregular heart rhythms and whether that the data that's coming into the wearable would suggest that maybe there's actually an abnormal heart rhythm or an arrhythmia. And so things that contribute to high heart rate variability or increasing heart rate variability over time. So things like increased cardiorespiratory fitness. So people who are more fit are generally going to have higher heart rate variability, increased sleep quality. Some decrease in exercise volume or intensity can also help with heart rate variability. Decreased psychological stress, youthful age, and then generally being a male would increase heart rate variability. And then the things that contribute to a low baseline or a decreasing heart rate variability over time. So things like decreased fitness, decreased sleep quality, and then the ideas of overtraining or inadequate heart rate or inadequate exercise recovery after training, those can actually decrease heart rate variability over time. Increased stress, things like systemic illness or infection, it does kind of gradually decrease over time as well. And then female sex would also cause the baseline to be slightly lower. And then looking specifically at the PPG data versus the ECG data, there's some additional things that we can glean that can help us with understanding what is going on physiologically in the body. So just as a baseline, we see the waveforms that we described earlier, and then these are the the electrical impulses of the heart rhythm. And then if you look at it and you allow baseline wander, so what you're really starting to see here is that generally the ECG changes with respiratory variation, and so you see this wander, and if you modify the amplitude based on the wander, then you can help estimate the respiratory rate through this type of data, which really has nothing to do with it's obviously heart data, but we can also give the respiratory rate, so we can use that so that we have kind of multiple bits of data. And then the frequency modulation, which was what we were talking about with the heart rate variability, or looking at the differences between these peaks, can help us with looking at the heart rate variability, and then beyond that, the heart rhythm analysis. So I think one of the most important things to talk about in this study or in this talk is the idea of atrial fibrillation. So I think that wearable devices, one of the key things that has been studied in wearable devices is the idea of screening for atrial fibrillation. So, especially in patients who or people who don't know if they have atrial fibrillation or not, but they may have some risk for it. These types of devices obviously can look for atrial fibrillation much more frequently than medical devices. So, generally, if someone presents to our office and has symptoms that suggest it, we may order a medical device where they wear it for a day or 2 days or even, a week or 2 weeks. But those are still shorter than if you buy a device that you could wear, most of the time, and then it tracks a reasonable amount of time. So I think that is an important, important use case for these types of devices. Also can be helpful for people who know they have atrial fibrillation to see whether they're going in and out of it a lot, and also to see if their heart rate is controlled when they're in or out of it. And so just as a basis, so the normal rhythm, there's an organized rhythm kind of based on the heart's pacemaker, which is the sinoatrial node, going down to the atrioventricular node, and then the electrical impulses go down to the bottom chambers here where the blood gets pumped out to the lungs and then to the body, and then it's coordinated. A coordinated electrical impulse. And then atrial fibrillation is this disorganized heart rhythm, generally coming from the left atrium and causing very irregular beats from the bottom chambers as these disorganized impulses reach the AV node. And so to start with, one of the studies that looked at this was called the Apple Heart Study. And so obviously this was using a smartphone application and an Apple Watch, and they recruited over 419,000 participants to be monitored for irregular pulses. And then the patterns that suggested possible atrial fibrillation were detected in about 2,000 or just over 2,000 participants. And so those people were then mailed a 7-day ECG monitoring device to look for the presence or absence of atrial fibrillation. And so what we saw is that it was a very low number of people, so less than, or just about 0.5% of the people in the study got a notification that they might have an irregular pulse. And then, but of those, it was generally the people over 65, like just over 3% of people over 65 that got that notification, and then lower numbers as ages decreased, which we would expect because atrial fibrillation or abnormal heart rhythms generally are more common as people get older. And so of those, they documented about 34% of the time that patients had atrial fibrillation. Of the 450 patients who turned in their monitors, about 153 of them had atrial fibrillation. So the yield was in the 35% range. And then looking at the end of the study, it looked at the patient or the people who got notified for irregular heart rhythms versus the people who didn't get notified. So the watch didn't say that they had any abnormal heart rhythms. And so we see a much lower number of atrial fibrillation, or a much lower percentage, 1% of the people who didn't get notified ended up having atrial fibrillation versus 43% in the atrial fibrillation group, or in the notification. So it did a pretty good job. And so as a final, final conclusion, the probability of getting notified of an irregular pulse in this big population was very low. But among those, 34% actually had atrial fibrillation on a medical device, and then which meant that the positive predictive value of that notification was 84%. So meaning if you took the number of truly positive people, divided by the number of notifications, the true positives versus the false positives, it did a pretty good job of identifying atrial fibrillation. And similarly, so other devices did similar studies. So the Fitbit did a similar study, and we see really similar numbers actually. So again, the notifications in a group of 450,000 people was about 1% irregular heart rhythm notifications. Again, the fraction with atrial fibrillation on the patch monitoring was about 32%, so very similar numbers. And they felt like their positive predictive value was even higher. It was 98%. So again, I think these types of devices can be very helpful in identifying possible atrial fibrillation in people, in a large proportion of people. And since these are readily available, this can be an important part of helping keep people healthy. Just again, some of the continued data, and again, similar to the Apple data, the Fitbit data, clearly the people who did not receive a notification, about 1% ended up having atrial fibrillation compared to 34% in the detection arm. So again, very similar data that these types of devices can do very well. And they did give a little bit of interesting information about the burden of atrial fibrillation. So this is like the percentage of time in atrial fibrillation. So, about 18% were in atrial fibrillation 100% of the time on the patch monitoring, whereas the vast majority of them were in atrial fibrillation a very small percentage of the time. So probably, 2.5 to 5% was the vast majority. And then also how much or how long these episodes were. Generally about half of them were less than an hour. So, with this blue being an hour and these being less than an hour. So, again, it was able to detect pretty short duration episodes of atrial fibrillation. And so as such, some of our guidelines are starting to come around to the idea that wearable devices could be very helpful. And so this, here is the cardio device, which is not technically a wearable, but is a device that people can buy, and it can give them an ECG. And so they have data where, if people randomly check their heart rhythm with their device, they can detect atrial fibrillation more commonly than if they don't do it. And so I think that, as we kind of move forward and these types of devices improve, it can be helpful to identify patients or people who may have atrial fibrillation. And as our population ages and as, the risk of atrial fibrillation goes up with age, and, given the statistics that probably at least, for most people, they have about a 1 in 4 chance of having atrial fibrillation over their lifetime. It can be important to try to identify those people to prevent stroke. And then also the idea of looking at the data to see how we're doing if people are having recurrence after, undergoing ablation for atrial fibrillation, or also monitoring heart rate with treatments in a rate control strategy. So I think that this, we're continuing to move forward and incorporate this data even in the medical guidelines. I don't want to spend too much time on this, but basically, this is kind of the idea that different devices have pretty similar sensitivity and specificity. So they do a pretty good job of identifying atrial fibrillation, and also, it's fairly specific again. So I won't spend too much time on that. All right, and then I will say one of the limitations of these types of devices is the idea of accuracy of the heart rate. And so what we see when you're in normal rhythm, the green at rest, it's a very linear relationship between an ECG monitor and the fitness tracker. And as you exercise, you see more scatter. So again, they don't do as good a job with exercise as when you're just resting. And then when you look at atrial fibrillation specifically, there's definitely a lot more green scatter here. So even at rest, they don't do as good a job as an ECG monitor. And then the blue the blue during exercise, you even get more scatter. So I think that is one limitation of trying to track heart rate, especially in atrial fibrillation. I want to spend just a second talking about the idea of AI analysis. I think that this will become even more of something that we look into in the future. But one of the early studies here was a Fitbit study that was just released as an oral abstract at the Heart Rhythm Society talk earlier this year. And so this used heart rate and step count data, and they enrolled 14,000 people, mostly females. And basically they ran different AI algorithms, and they found that actually the best algorithm could predict whether someone was going to end up in the hospital with a 91% accuracy. So I do think that, like, thinking about the idea of using these types of AI algorithms may be very helpful in the future, and I suspect that we'll see much more of this, but just something to keep an ear down for. However, I always want to talk about the idea of could we have too much of a good thing? So sometimes the amount of data can be overwhelming to people who are looking at it. So if you are looking at your data, your watch data or wearable data, sometimes that can be overwhelming to you. The other side of it is that it also can be overwhelming to your providers if you bring in reams of data and they only have a certain amount of time that they're able to spend with you. And so some studies have shown that it can increase anxiety. And so specifically, there was a study in people with atrial fibrillation who was trying to look at the psychological well-being. And so, they asked questions like the behaviors of whether they would contact their doctor if they had an abnormal ECG or possible atrial fibrillation. And, there was a fair proportion, like 40% said, yeah, sometimes or always. And then, if they had an inconclusive, there was still some of those. And then would you go to the emergency room based on it? And again, 5% of people would go to the emergency room. And then they asked about anxiety. So, how many people have anxiety from a low or high heart rate? And again, it's, in this sometimes or always, it was a decent amount of people who would develop some anxiety from, about half of the people would develop anxiety from that type of data. And also, even more so if it said possible atrial fibrillation. But on the flip side, people also felt that it made them feel safe. So more people felt safe if they were checking their heart rate or their heart rhythm. So I think that's, we have to kind of balance the good and the bad here. Another area, another subset of people who is at high risk is our patients who have heart attacks. And clearly, if you have a heart attack, then you're going to have some higher risk of having a future cardiac event. And we have significant data in support of things like cardiac rehab. But the idea of wearable devices may be a very cost-effective intervention to help reduce the risk of some kind of cardiovascular event in the future. And so this was a small study, which was called the MyCore trial, where they developed, daily care plan, educational videos, medication tracking, blood pressure management, physical activity tracking, mood assessment, and then follow-up appointment management using an Apple Watch and a blood pressure monitor. And so they had this special app called Corey, and so patients were enrolled when they had symptoms and they had a heart attack. And then they, again, track their vitals, daily care plan, education, data analytics, and follow-up plans. And then with the idea that the value would be that we could improve adherence to the medications that their providers wanted them on, we could prevent people from ending up back in the hospital within 30 days and improve the patient and clinician experience. And based on this trial, they did show a 52% relative risk of being readmitted to the hospital within 30 days. And because of that, it was very expensive to come back in the hospital. So then the cost savings were immense. So we're talking $10,000 per patient with the intervention group. So, so now they're kind of trying to use the system to also do a virtual cardiac rehab. So we'll see that data in the future. But I think it's an interesting point that you may see at some point in the future where these types of interventions are really helpful, and that hospital systems and physicians may encourage patients to enroll in them so that we can help keep everyone healthy and happy. And so activity feedback, I think, is an important part of wearable devices. And so the devices that give feedback on activity levels can encourage people to be more active, and we'll talk about the downstream benefits of that. So there's a meta-analysis looking at daily step count. So this is the idea that if you wear a device that encourages you to be active, then you'll be more likely to get more steps in. And so anything to the right side here favors that type of intervention. So wearing the device, and if it were on this side, I would say that it would be the opposite. You should not wear the device. And so on the whole, kind of pooling all of these different studies, there does seem to be a significant improvement in step count with these types of devices that encourage daily activity. And then similarly, we see also an improvement in the VO2 max, which is the oxygen consumption measure. Again, that's important to say, because when we look at like patients with heart failure, VO2 max improving is a very clear indication that they're doing very well with regards to heart failure management. So, I think that these types of interventions clearly can make a difference. And so I think this is some of that data. And then, so why do we care about that? Well, when we look at, mortality compared to activity, we definitely see an improvement in all-cause mortality as well as cardiovascular mortality. This has some differences between male and female, but we don't have to focus on that. But basically, increased activity does help lower mortality. And so that's where I think we see the biggest benefit with these types of devices in the big population. And so just to briefly say the guidelines would say, 150 minutes per week of moderate activity or 75 minutes of vigorous activity. And I think that that's where really, a wearable device can help people track that and say that I'm getting, moderate activity based on my heart rate and track the number of minutes. Just briefly, the use of wearables, I think that the key point to this, about 50% of people were using a wearable device every day. The key point for me as a cardiologist was that about 25% of patients with cardiovascular disease were not using them. So I think that that's an opportunity for us as cardiologists to try to improve that, because I do think that could potentially impact their health and really help keep our patients healthy. Oops. All right. So just to focus on, as we're wrapping up here, a few kind of ideas for what the difference is, what different people might find most helpful with regards to wearable devices. So if you looked at a 35-year-old male who's healthy and is looking to exercise and increase his longevity, I think that kind of following the physical activity guidelines of moderate or vigorous activity, like we just talked about, would be kind of a primary goal. And so the things that you could get from wearable devices to try to get that would be, monitoring heart rate and trying to do, 50 to 70% or 70 to 85% of maximal heart rate. Maximal heart rate is defined as 220 minus your age, to try to drive that kind of longevity. But that being said, if we contrast with a 76-year-old person who's sedentary but has obesity and diabetes, then just activity of daily walking, getting steps in, and so using the wearable device to count steps and do that on a routine basis, I think would be a very helpful intervention. And then, or a 43-year-old with poor sleep and a family history of coronary disease and has risk factors of high cholesterol and high blood pressure, but sleeps poorly, using a device like an Oura Ring or some other device to try to monitor sleep to get 7 to 9 hours could be, a targeted therapy there. So just to wrap up some of the key uses, I think tracking movement to adhere to the movement guidelines, screening for atrial fibrillation and tracking heart rate and recurrence, aid in diagnosis for infrequent symptoms. We didn't talk much about this, but clearly our medical devices are short duration. So if people have things like palpitations that only happen every month or every other month, and sometimes these types of devices where you can check an EKG when you're having symptoms can be helpful, and then you can show that data to your providers. Again, tracking sleep, monitoring for substantial changes in activity or heart rate variability that may suggest some kind of change in health status, such that you would want to talk to your providers about whether a change is necessary in medical therapy. And then also, obviously, we didn't really get into it a lot, but the idea of using the data to track athletic training to try to improve, for competition or for just overall health. Some of the limitations, though, again, like I said, heart rate may be less accurate in things like atrial fibrillation. The idea that the sensors aren't on all the time. And so again, if it's only on a portion of the time, you could miss, some things if they're infrequent. Generally, the devices struggle to identify heart rhythm issues that are abnormal but have a regular pulse. So things like atrial flutter, if it's irregular, it may not identify that at all. And then patient-specific things with regards to how you wear it. So if it's too loose, if it's malpositioned on the body, that could limit it. And then, like I said, no collection of data during charging or not wearing. There's an idea that Medicare covers a remote physiologic monitoring, but that's not these devices. It's only medical devices currently. But I think that if that were to expand in the future, I think that this type of thing may also drive kind of the idea of integrating this into clinical care. But I think that's a kind of a future step. For those who are interested, it's not that hard to get involved with studies. So things like the Apple Research app can help people, join if they want to be a part of the research that helps people live long, healthy lives. So I think that searching those out can be an important thing for humanity, and so I encourage people to do that. And so that we have a little bit of time for questions, I'm going to be done.
All right. Thank you, Dr. Shapiro. That was very informational, a lot of data too. So thank you for that. We do have a few questions, but want to remind our audience that now is the time for questions. So please put your short general question in the chat box below the video, and we'll get to as many as we can. And I'll start asking questions in no particular order. So if Dr. Shapiro was to go out tomorrow and buy a watch for health and wellness tracking purposes, which one would you purchase?
Ooh, I think that's a tough question. I think that I think there's so much competition in the space that that they're really I think all the companies are forced to really do a good job in this. So part of it depends on what ecosystem I think any individual is in. So I mean, clearly, if you have a Google phone, then probably a Fitbit watch is going to integrate better with yours. If you have an Apple phone, it's probably going to integrate better with an Apple device. And I think it also depends on the use case. I mean, personally, I have an Apple Watch because I have an Apple phone, and I like that. I wear a Garmin strap on my bicycle and integrate that with my Garmin head unit. I think that the reality is that there's so many good devices these days. I think you can get a lot of good data from many of these devices. So I'm not too concerned about a specific one.
Okay, thank you. For the Apple Watch Q, we have a couple of questions. Is there anything patients can do to make sure they are getting good readings regarding the heart rate and EKG functions?
Yeah, I think that's a good question. I mean, I think that the thing that we see, with regards to the EKG function, it's definitely limited by significant artifact at times. So I think that trying to stabilize your arms, so like resting things on a table, and trying not to move as best you can during those acquisitions for the ECG portion, because clearly, the challenge with the data is that these types of devices are they're very prone to artifact from motion. With regards to the heart rate, I think the key things there are making sure that the device has good contact, with your skin, and that it's, it has to be tight enough, especially when you're exercising, such that it's not moving around a lot, or else that type of data will be affected by it.
Okay. Does Wolff-Parkinson-White syndrome fall under the umbrella of AFib? And if so, would an Apple Watch detect an episode?
No. So Wolff-Parkinson-White syndrome is a bypass track around the AV node. So meaning that the top chambers communicate electronically with the bottom chambers outside of the normal conduction of the heart. And so Wolff-Parkinson-White is not, so most frequently that's associated with other supraventricular tachycardias. So yeah, the watch would not discriminate to say that it's it's a specific supraventricular tachycardia. Now that being said, clearly we can see patterns that can be suggestive of those types of findings. So for instance, if someone is wearing their watch and their heart rate is 60 and then it jumps up to 190 and stays at 190 and then drops back down to 60, that might be suggestive of that type of heart rhythm, some kind of heart rhythm issue related to Wolff-Parkinson-White, but yeah, very different thing. So, and really the algorithms are generally looking for the irregularity between the QRS complexes. So that's why, they've really started with the low-hanging fruit, because they figured out algorithms that could pretty easily identify atrial fibrillation. The devices really struggle at finding more regular rhythms.
Okay, thank you for that clarification. What is the easiest wearable to use for blood pressure monitoring?
That's a good question. I know that there's multiple devices. I think there's the Whoop band, I think, has continuous blood pressure monitoring, and some of the Samsung watches may have some blood pressure monitoring. Honestly, I'm not an expert as to which one is going to be the easiest to use. So I would kind of defer to maybe some online reviews on how easy they are to use.
Okay, perfect. Thank you. Can any of these devices measure PVCs?
So they don't identify PVCs. You can clearly, if someone knows what they're looking at when they look at the ECG, you can identify PVCs. So for instance, I have patients who, are having palpitations, and they bring in a recording of the symptoms they were having, and I see, a 30-second strip of their ECG that they recorded from their watch, and I may see a couple PVCs in there. And so, your physician may be able to look at it and say that the device is not going to tell you necessarily that it's PVCs. I think maybe the cardio device could also identify PVCs. So I think that one is a possibility.
Okay. Do any of the wearables do a reasonably accurate job of measuring blood sugar, also blood pressure?
So yeah, I didn't get into. The wearable. There are patches, like the Dexcom type patches that diabetic patients, have gotten as prescriptions for several years, and then some of those are now available as consumer devices. I didn't really get into that specifically. So there are devices that can be purchased that will do continuous glucose monitoring. So that yes is the short of it. They're not like your watch, but actual patch device that people wear. And then the other question was blood pressure. Yeah. So again, some of the watches can do blood pressure as well. Again, I think that is kind of in its early stages. They really focused on the heart rate, heart rhythm stuff to start with, and I think that'll continue to improve and could be a more pervasive functionality in the future.
Okay, thank you. This person was not clear on what to wear for PPG SCG.
So, yeah. So generally, I would say that the vast majority of the devices are PPG devices, so I don't think you have to. I don't think you have to pick a specific device per se. So I guess I would say, like, most of the consumer wearable devices that are like the smart watches. Obviously, the cardio device is just an ECG device, but any of the ones that have like a light that you see on the skin side, those are going to be PPG devices.
Okay. How does the data get shown or transferred to the doctor?
So yeah, that's I think that's been one of the challenges in using these devices in the healthcare setting. I think ideally, we would find secure ways to transfer data, electronically and automatically to the electronic medical record. I think the challenge there is that the companies that make the devices, and since they're not making quote unquote medical devices, they haven't want to spend the time to create the APIs that really securely communicate with with the medical record and jump through all those hoops. So generally right now, this type of data has to be this is where it becomes the responsibility of a person to get their data and then get it to their physician. That could be transmitted electronically through the electronic medical record as an attachment, or brought in, to a clinic visit. But yeah, I think that would be a nice future where these types of things, were integrated and directly transmitted. But unfortunately, it's kind of not the case right now. And I think that it's always a question of whether, the costs of doing that for the companies, and also the burden of looking at it on the healthcare system. I think it's a balancing act and finding the right levels there. So it's kind of TBD.
Okay. How well do they monitor oxygen levels?
I didn't get into the data, but I think generally speaking, they do a reasonable job. Again, assuming that that you have good contact with the skin. But I don't know. I don't know a specific accuracy number, so I don't want to give that type of data.
Okay. Do you have any recommendations for vagus nerve stimulation devices?
I don't. Yeah, I mean, I'm not aware of that being a consumer device. I think that would be a medical device. So I think that I would bring that up to your physician.
Okay. How would you best recommend improving HRV efficiently for fitness training?
Yeah, I mean, I think that's a complicated question. It kind of depends on the individual. A lot of people locally kind of focus on heart rate zone or power zone training, and looking at mixing different types of training protocols to improve cardiovascular fitness. But really, yeah, it really depends on the individual. But I think overall, if you just generalize, I would say that people who are being active and doing some kind of exercise routinely are going to generally have higher HRV. And then kind of looking at the specifics, I think that an individual could talk to a personal trainer or their physician about kind of what they would specifically like to do to get to their goals.
Okay. We're going to try to squeeze in a few more questions here.
Okay.
And then wrap it up. Is there any study that shows any benefit from using both, combining a watch and a ring?
I am not aware of a study that specifically combined the watch and the ring. I think that they generally do. Some of them do similar things. I think that the ring the R-ring, focuses a lot on sleep, and obviously that can be one of the limitations of the watches if they need to be charged overnight. That you get that data. But yeah, I'm not aware of but I think most people that use both kind of use them for different metrics, and so I'm not sure that I think that does help give you more data, but I don't know of the specific combination study.
Is HRV a useful measure to provide indication of any particular heart problem?
Yeah, I mean, it's kind of a complicated question. So generally speaking, HRV can be decreased in certain heart conditions. So things like heart failure or coronary artery disease after a heart attack, those types of things. So it can be, we clearly could see some decrement in that in people who have cardiovascular disease. But that being said, there's clearly there are other more acute things that also infection or just general inactivity can also contribute. So I think that it's probably most helpful for most people to kind of trend this, and then if there's a significant change which looks negative over a short period of time, that kind of focusing on that with their providers.
Is there a wearable device that approaches a loop monitor in usefulness and accuracy, at least in some readings areas?
Generally speaking, I would say that clearly the accuracy of the wearable devices is not as good as a loop recorder, which is an implanted medical device which monitors for heart rhythm issues for a long period of time, up to like 3 years, depending on battery life. I do think that clearly the stroke, there's an update to the stroke guidelines that says that it can be reasonable to consider wearable devices to try to monitor for atrial fibrillation in patients who've had a stroke, who are unwilling or unable to wear a patch device or to undergo loop implantation. So again, I think it's better than nothing. I would say it's not as good as the medical devices.
Okay. Last question. Some of the devices claim to tell an athlete how much is left in the tank, such as how rested they are, etc. Is this accurate?
I think that it's, I think that those proprietary algorithms are kind of tough to say how accurate that is. I think that if you have if you're already using one of these devices and it's giving you that type of data, if that seems pretty accurate to the individual, then I think that's a helpful data. I think we've all used devices that said things like that, and you felt good. And so I'm not sure that at all times that's obviously accurate.